Hi everyone, my name's KAHILU SAMUYACHI. I'm currently serving as the M&D specialist under the Keeping Girls in School project, which is being implemented. I have a bachelor's degree in demography and a master's in public health. So the study topic is COVID pandemic. Okay, so in terms of the outline, the background, we're also going to look at the study aim as well as objectives, and then we'll go further to look at the methodology, and then look at the key findings, conclusion, and then later on discuss the recommendations. So as we all know that the COVID pandemic is an acute respiratory disease, which is very transmittable and quite fatal. So its impact has been found to be more among the aged, those with underlying medical conditions, and also more to do in pregnant women. So little is known about its impact among the homeless street kids, and so that is why this study was really trying to look at how COVID affects vulnerable groups. And in this case, we're going to look at homeless young adult street kids. So the success of the Zambia COVID response is premised on individuals and communities' adherence to the 5 golden rules. And these include wearing of face masks, maintaining social distancing, frequent hand washing, avoiding crowded places, and also being vaccinated. However, adherence to these principles is dependent on how people are well vested with knowledge with regards to COVID, as well as how they perceive themselves, whether at risk or how they perceive COVID generally, and also whether they are practicing the 5 golden rules and how they are protecting themselves from having the having COVID. So in terms of the objectives and the aims of the study, um, the study was aimed at accessing the knowledge, attitude, and practices of young adult streets being a vulnerable group towards the COVID pandemic. So we just wanted to assess the knowledge, the attitude, as well as the practice among the homeless young adult street kids within Lusaka. In terms of the main objective, the objective of the study was to determine the knowledge, attitude, and practices towards COVID-19 among homeless street young adults in Lusaka. Specifically, we had two objectives, and the first one was to determine the level of knowledge related to COVID-19 among the homeless street young adults. The second one was to determine how knowledge influences the attitude, practices, the second specific objective was to determine how knowledge influences attitude as well as practice towards COVID preventative measures among the homeless street kids. So that we had two objectives there. In terms of the methodology, the study employs the concurrent mixed method approach. So here, we had structured questionnaires that were developed, as well as we had an interview guide, and we had focus group discussions with the participants. And then in terms of the focus areas, the study focused on popular spots around Lusaka where most homeless young adult street kids are found. And these Zesco flyover bridge area, Kamala traffic lights area, Levy Mall flyover bridge, North Mid area, as well as Cairo Road, the post office area. I'm sure we're all aware that this is where most of the street kids around Lusaka are found. So in terms of the sample size, a total of 89 homeless young adults street adults aged between 16 to 35 were sampled using the Cochrane formula around the popular spots in Osaka. So in terms of how we came up with this sample size is that we assumed that there are 1,000 over 1,000 street kids around Osaka, and so that's how we calculated the 89 sample size. In terms of the data analysis, Stata version 13 was used to produce descriptive statistics while thematic analysis was used to analyze the qualitative data. The key findings, so like we earlier mentioned, the study focused, the study had a sample of 89 participants, and majority of the participants were male at 78%, while 62% were single. And then in terms of education, 59% had at least been to primary school. So those were the majority. And then in terms of the study sites, like I mentioned earlier, the study we had about 6 study sites, and so the majority of the participants came from North Mid area, which was at 32%, and the least was Kamala traffic lights at 10. Sources of information. So we were also where participants get information related to COVID pandemic. And so most of them reported that they get this information through the radio. And this radio is not that they have the actual radio, but because they are within the streets where radios play around, so they normally listen to this kind of information. In terms of knowledge towards the COVID pandemic, the knowledge test over a correct score was between 43 and 71. And so participants who scored less than 44% were considered to be less knowledgeable, while the ones that scored 70 and above were considered to be knowledgeable. So overall, we had 49% of participants who were actually knowledgeable because they scored above 71%. So 49% of them were knowledgeable with regards to COVID pandemic. And issues of knowledge were focused on whether participants knew how COVID is transmitted, whether participants know the symptoms of COVID, whether participants knew that COVID could be transmitted through animals, and who is at more risk of contracting COVID. And so those were the areas that we focused on in terms of knowledge. And so a significant number of participants had correctly identified that COVID was transmitted via respiratory droplets of infected individuals. And the participants had actually identified that COVID is transmitted through respiratory droplets was at 81%, while only 30% were knowledgeable that COVID could be transmitted through eating or contracting wild animals infected with COVID. So you see here that most participants were not aware that COVID could be transmitted through eating or contracting wild animals. And further, a higher proportion of participants identified the common clinical symptoms. So most of them were 72% of the participants were able to identify the common clinical symptoms. And also the ways of preventing it. Most of them spoke to issues of wearing a face mask as an effective way of preventing COVID-19. In terms of the influence of knowledge on attitude and practice, so despite most of the participants being knowledgeable about COVID-19, most of them really had a poor attitude. So in terms of significancy, of course, there was a relationship between knowledge and attitude, and the p-value was less than 0.01. So there was some relationship between somebody's level of knowledge and their attitude. So ideally, you would expect that people that are more knowledgeable would have a positive attitude. But in this case, the findings revealed that 59% of participants who are less knowledgeable were more likely to have a good attitude as compared to participants who are more knowledgeable. Okay, that was in terms of attitude. In terms of practice, however, we didn't find any relationship between knowledge and practice. There was generally a poor practice towards the COVID preventative measures among all the participants, and you could see that here that only 3% of the total were practicing, had good practice towards the COVID preventative measures. And so this is really worrisome, because if people are not practicing, then we risk these vulnerable groups having COVID-19. So in terms of the conclusion, although knowledge and attitudes towards COVID-19 were quite high among homeless street adults of Lusaka, the good practices were alarmingly low. These findings underscore the need to develop strategies specific to these vulnerable groups. And so what we're proposing is that there's really need to ensure that we come up with better practices and better strategies to ensure that these vulnerable groups, firstly, they're knowledgeable with regards to how COVID is transmitted and everything surrounding COVID. They develop good attitudes, and also that they practice some of these issues. Of course, we understand that because they're vulnerable groups, they are unable to have access to certain things like buying of um, hand sanitizers, face masks, but we really need to find a way in ensuring that these vulnerable groups are catered for. In terms of the recommendations, we're recommending that the national risk communication campaigns on COVID must provide key messages about the benefits of practicing social distancing and promote a combination of prevention methods so that the homeless street young adults can acquire and practice reliable and effective prevention measures. The second recommendation is that since the study shows that over 40% of the target population perceive themselves to be at a lower risk, there is need for government to take serious action in developing targeted interventions to protect these vulnerable groups from contracting the COVID pandemic or COVID virus. The third recommendation is that since the evidence presented further suggests that more in-depth studies need to be conducted with representative sample size of street young adults from various geographical areas, both rural and urban. And more importantly, there is need to use more rigorous design methods and sampling strategies so that we provide further evidence for programming and policy. So these are the recommendations that came out from this study, and we hope that various policymakers take serious actions with regards to this. This is the end of the presentation. Thank you.